Next bill on third reading.
Committee substitute for House Bill 5297 relating to prohibiting pubertal modulation and hormonal therapy when provided to assist in a gender transition.
Ladies and gentlemen, this bill was advanced to third reading yesterday with 2 amendments pending. At this time, the clerk will please report the first of the 2 amendments.
Delegate Pushkin moves to amend the bill. This is HFA Pushkin number 2, 2-27.
Would the gentleman like to explain the amendment in lieu of having it read? Lady Ms. 73rd has raised a point of inquiry. Lady will state the question.
I believe that the 2 amendments might be competing. They both refer to adding a section, an additional number 5.
Does the gentleman agree?
Yes, if the first amendment would be adopted, then I would just move to amend the second one to number it 6.
Okay, in light of that, we'll proceed with the amendment that's now been announced by the clerk. Okay. So, gentlemen, are there objections to allowing the sponsor to explain the amendment in lieu of having it read? No objections are heard, and the gentleman from the 54th Delegate Pushkin is recognized to explain the amendment.
Thank you, Mr. Speaker. As I began explaining this amendment last night, it's fairly simple. The bill itself, what it does, it removes the amendment that was made by the Senate last year, and the bill that was mainly meant to ban surgery for minors. The amendment that was made allowed for some very narrow exceptions in regards to this type of therapy, a reversible therapy, but to very narrow exceptions for patients with severe gender dysphoria. What the bill does, not the amendment, what the bill does is it removes those exceptions. This would create a grandfather clause, if you will, for patients that are already receiving this therapy, that they would not be kicked off their therapy. So it's fairly self-explanatory. I reserve the right to close.
You've heard the amendment explained. Now the question is, shall the amendment be adopted? Is there debate on this amendment? Lady from the 73rd Delegate Summers is recognized.
I just want to clarify, this is number 2, not number 1. Okay, let me relook at my notes, sorry. Okay, this amendment adds back in the Senate's language from last year relating to pubertal modulation and hormone therapy for severe gender dysphoria, and attempts to grandfather those patients receiving treatment for that diagnosis back in. Under the current bill, though, however, that's before us, there is no denial for treatment for minors except for 2 things. 1, irreversible gender reassignment surgery, and 2, prescribing gender-altering medication for the purpose of assisting a minor with gender transition. This amendment inserts language that indicates the pubertal modulation and hormone therapy is prohibited and causes confusion, I believe, to the providers. So I urge rejection.
Is there other debate on the amendment? Is there other debate on the amendment? If not, Chair will recognize the sponsor, gentleman from the 54th.
Thank you, Mr. Speaker. First, I just want to point out that you should still have on your desk, this was passed out yesterday. It is a letter from healthcare providers from all over the state. I believe there are 400 signatures of healthcare providers basically stating the risk that they see in passing the bill as is, well, the bill in general. The amendment makes it slightly better and more humane, just saying the patients who are already undergoing this can't be kicked off. That's all it does. So I would urge adoption of the amendment.
The debate on the amendment has been closed. Question now is, shall the amendment be adopted? Those in favor of adoption of the amendment will please say aye. Aye. Those opposed will please say no. No. Noes appear to have it. Okay, noes have it. Chair declares that amendment lost. Clerk will please report the next of the 2 amendments.
Delegate Pushkin moves to amend the bill. This is HFA Pushkin number 1, 2-27.
Are there objections to allowing the sponsor to explain the amendment in lieu of having the amendment read? No objections are heard, and the gentleman is recognized. The gentleman would like the amendment read. Clerk will please read the amendment.
Delegate Pushkin moves to amend the bill on page 2, section 20, line 40, following the semicolon by striking out the word and on line 43 by striking out the period, inserting a semicolon and the following, and 5, the adolescent's attending physician expresses in a written opinion that treatment is medically necessary to treat the minor's psychiatric symptoms that makes the minor a danger to commit suicide without such treatment, and on page 5, section 17, line 39, following the semicolon by striking out the word and on line 42 by striking out the period, inserting a semicolon and the following, and 5, the adolescent's attending physician expresses in a written opinion that treatment is medically necessary to treat the minor's psychiatric symptoms that makes the minor a danger to commit suicide without such treatment.
Question now is on the amendment read by the clerk. Chair recognizes the sponsor, gentleman from the 54th.
Thank you, Mr. Speaker. What the amendment to 2007 did last year was to create these very, very narrow exceptions. Obviously, if this bill does away with all those exceptions, this adds one extremely narrow exception, and that's if the child is diagnosed as suicidal. That's it. I just want to make it very clear what we're voting about here. I'm not sure what severe gender dysphoria is versus just gender dysphoria. I think it's either one's diagnosed with it or not. I don't know if severe even exists as a condition, but I do know that danger to oneself does exist as a condition. I think we should, at the very least, make this very narrow exception. The patient is a danger to themselves.
Lady from the 73rd, Douglas Summers, recognized.
Thank you, Mr. Speaker. The amendment, as the delegate spoke about, reinserts a fifth exception on physicians may provide any of the following to a person who is under the age of 18. I think the amendment makes the bill more restrictive because psychiatric care is not prohibited in this bill. As I said before, the only thing in this bill that is prohibited is irreversible gender reassignment surgery for minors or prescribing gender-altering medication for the purpose of assisting a minor with gender transition. There's no prohibition to treating someone with severe gender dysphoria, unless you would get to the point where you would be giving them supraphysiological doses of hormones. I would urge, yes, which would assist with transition. So I would urge adoption if you want to require a minor's psychiatric symptoms to be treated after they get a written opinion from a physician, or I'd urge rejection if you'd like to leave the bill in its current format where there are no written opinions required for a doctor to treat a minor's psychiatric symptoms.
Is there other debate on the amendment as read by the clerk? Gentleman to 79th, Douglas Hanson, is recognized.
Thank you, Mr. Speaker. Would the delegate who just spoke yield for a question?
Yes, 73rd.
73rd, thank you. I'm trying to reconcile what you said with what I thought the bill did, and so I wanted to try to understand that. The bill removes language on page 3, lines 55 to 57, and it talks about therapy limited to the lowest titratable dosage necessary to treat the psychiatric condition and not for the purpose of gender transition. And
I'm trying to find where you're talking about. What line?
line 55 to 57.
Oh, you're in the bill that's been removed, the part that's been removed.
The part that's been removed.
That's been struck. Okay, sorry, can you repeat that?
Yeah, so I'm trying to understand, so the current state of West Virginia code, where that paragraph is in state code, it does have a prohibition against using these drugs for gender transition. Is that right?
Those lines are there, so they're really unnecessary because that's already in the other part of the bill.
But the bill would remove that.
It's already stated in another part of the bill.
Where's that?
Let me just get it for you. I'm not understanding your question completely, but let me just say, it says, any use of gender-altering medication is for the purpose of pubertal modulation and hormone therapy will be limited to the lowest titratable dosage necessary to treat the psychiatric condition and not for the purpose of transition. That is already stated in the bill because you are not allowed to give super physiological doses, but low doses of hormones for, say, a psychiatric condition of anxiety or depression that they feel can be assisted with low-dose hormones. That's already allowed by not excluding it.
So it's your interpretation of the bill, and I know this is straying a little bit from the amendment, but the reason why I'm asking is because I think you had brought up that this is related to the amendment. And so just to understand, I think your interpretation of the bill is that paragraph D that we're talking about, lines 55 to 57, is already included elsewhere in the bill. And so these types
It's included by not prohibiting it. So when you look at the exceptions that are allowed, that talk about a physician may provide the following to anyone who is under 18. The reason those exemptions are listed there, they have to do with the main purpose of the bill. So if you cannot give someone gender-altering medication for the purpose of assisting an individual with a transition, there are exceptions because there are medically verifiable disorders of sex development where children would need to be given supraphysiological doses of medication because their genitalia is ambiguous perhaps, and they are a girl, and they're going to be given these hormones to be raised as a male. So these are why you have the exceptions, because you're giving those higher doses. They also might have a disorder of sexual development where you need to do that. They may have had a gender transition procedure where they need treatment. That's why there's an exception there. And finally, there's another exception which might require a procedure because the individual has suffered from something that might have impaired their major bodily function. They might need a surgery. For example, they've had trauma to a certain organ of their body, and they might need surgery because of a life-saving measure. Those are why the exceptions are there. When the exception number 5 was entered, that does not really, it wasn't really necessary, but I think that the Senate felt that they wanted to make sure that that could be done. That is not excluded from the bill in its original format from last year.
Exception 5 is specific related to people suffering from severe gender dysphoria, though.
Yes.
So which of the previous 4 exceptions would that person fall within?
They don't need to be an exception because they are not prohibited from being treated for severe gender dysphoria in the bill. The bill only does the 2 items that I have reiterated.
Okay. Thank you for
You're
clarifying.
welcome.
I think we just have a difference of opinion about that. I think related more specifically to the amendment is pretty targeted to try to prevent suicides, try to help kids. So I would support the amendment.
Is there further debate on the primary amendment? Gentleman on the 55th, Douglas Akers, recognized.
Would the chairwoman of health yield, please?
Yes.
So just to be clear, it's your affirmation as the chairwoman of the health Committee for the West Virginia House of Delegates that if there's a child currently being treated for psychiatric conditions with hormone therapy, that this bill will not stop that treatment modality if it's best for that child with regard to that child and that physician relationship.
That is the way I read it. Now, if the dose was so large that it was supraphysiologic and it actually assisted that child in transitioning, then you would reach a certain level. But what has been expressed to me by physicians is that they are receiving lower doses of a hormone, and that tends to help with their anxiety and depression, but it's not doses that transition that individual.
Right, so if I look at lines 26 and 27 on page 2 of the bill, there's a new insertion that states that there may not be gender-altering medication, and there's a new insertion that says for the purpose of assisting an individual with gender transition. But does the insertion of that language also affirm what you just told us, which is for psychiatric treatment only, that this bill does not prohibit that? So, for example, if a child is determined to be suicidal by their physician, they can be or prescribed these medications for psychiatric treatment only, but not for transitional care.
I think you're stating that correctly, yes. And I added that language about for the purpose of assisting an individual with a gender transition, even though it is already in the definitions, I inserted that there just for clarity.
Okay. Thank you so much. May I speak to the amendment, Mr. Speaker?
Yes, the gentleman's recognized for that purpose.
With those affirmations from our chairwoman from Health, I would urge rejection of the amendment and adoption of the bill when we get to that stage.
Is there other debate on the amendment? Is there other debate on the amendment? If not, Chair will recognize the sponsor, Gentleman 54, to close debate on the amendment.
Thank you, Mr. Speaker. Before I close, would the chair yield again? One question.
Yes, lady does yield.
So it's your opinion that the amendment I'm offering makes the bill more restrictive?
I'm getting the right amendment. Not necessarily more restrictive. However, you are requiring that the adolescent's attending physician express in a written opinion that treatment is medically necessary to treat the minor psychiatric symptoms. That's not required in the bill. Now, that was in the language that was stricken. You had to go through multiple hoops in the language that's stricken. You had to be diagnosed with severe gender dysphoria. You had to get 2 medical or mental health providers, with at least one being a mental health provider or adolescent medicine specialist, and both having relevant training in the diagnosis and treatment of severe gender dysphoria in adolescents. You had to have written opinions. You had to have agreement in writing from both parents. You had to say it was the lowest titratable dose. You're saying in your amendment that they have to have a written opinion. That is not required in the bill as it's before us. So you're just adding an extra step. It might not harm the bill, but you are requiring additional step that's not necessary.
Okay. If that step's not there now, and I'm adding this step, that they would have to have this written confirmation from their doctor that they are suicidal, then you're saying that this amendment makes the bill slightly more restrictive, correct?
I think it does.
Okay. Thank you for yielding. I'll briefly close. I don't think I agree, but if you do and you want a more restrictive bill, I guess what your vote would be to vote in favor of the amendment. However, I'm going to side on the side of the 400 professionals who have also read the bill as it is and are concerned about patients who could be suicidal. Now, the original bill last year, we heard a lot of talk about irreversible harm. Now, this type of treatment is reversible. I said it in committee, I'll say it again, what is not reversible is suicide. I think the least we could do is to put in this safeguard so these patients who are a threat to themselves would be protected. So I would urge adoption of the amendment.
Debate on the amendment has been closed. Question is, shall the amendment be adopted? Those in favor of adoption of the amendment will please say aye. Aye. Those opposed will please say no. No. No's appear to have it. Okay, noes have it. Chair declares that amendment lost. Are there other amendments to the bill? If not, clerk will please read the bill a third time.
Committee substitute for House Bill 5297 relating to prohibiting pubertal modulation and hormonal therapy when provided to assist in a gender transition.
Are there objections to having the bill explained in lieu of having it read in full? No objections are heard. Relating to 73rd to explain the bill.
Thank you, Mr. Speaker. This bill continues the prohibited practice of irreversible gender reassignment surgery and prescribing gender-altering medication for the purpose of assisting a minor with gender transition. But it removes the provision placed last year in the bill that allowed pubertal modulation and hormone therapy for severe gender dysphoria after 2 specific providers have made that diagnosis and expressed it in writing. Parents also had to agree in writing, and the medication was limited to the lowest dose necessary to treat the dysphoria. Removing this provision does not impact a minor's treatment for other reasons that are not for the purpose of irreversible gender reassignment surgery prior to the age of 18. And don't forget, this bill doesn't impact adults at all. We're just saying children cannot have irreversible surgery and cannot take medication that transitions them prior to adulthood. I think that's about it, Mr. Speaker. I urge passage.
You've heard the bill explained. The question is, shall the bill pass? Is there debate on the bill? Is there debate on the bill? Gentleman, the 79th Delegate Hansen is recognized.
Thank you, Mr. Speaker. As you can imagine, I don't support this bill. There seems to be a difference of opinion about what this bill actually does. Current code has a very narrow circumstance in which a certain type of gender-affirming care is legal. And this bill removes that very narrow circumstance. So there is a difference of opinion about what this bill does. In my opinion, the bill will make it harder for parents and their kids to make their own healthcare decisions on a topic that's extremely sensitive and extremely personal. And I think it's rich that this is happening on the same day that the Parents' Bill of Rights passed this body. The Parents' Bill of Rights that says it's a fundamental right of parents to direct the upbringing, education, care, and medical care of their minor children. The Parents' Bill of Rights that says the state may not infringe on the fundamental rights of a parent to direct the upbringing and health care of their minor child. The Parents' Bill of Rights that says all parental rights are reserved to the parent of the minor child.
Gentleman, 78th Delegate Shirelli.
I believe the bill that we are discussing is House Bill 5297, not the Parental Bill of Rights.
That point is well taken. The gentleman will confine remarks to this bill, not to prior bills that have been passed.
Well, I'll tell you why it's relevant to the Parents' Bill of Rights.
Parents' Bill of Rights delegate is not on the floor. The gentleman has the floor for this bill.
The reason why it's relevant is that this bill removes language that requires parents' consent in order to undertake this type of therapy. There's a very narrow circumstance where parents can work with their medical providers and their children in order to allow this type of therapy. It requires the minor and the minor's parents in this bill to agree in writing with the minor's primary physician that this type of therapy is appropriate for their child, and that's why it's relevant. Because this bill is removing a parent's right to make healthcare decisions for their child. And the language that's being removed not only requires the parent's written approval and the child's primary physician's written approval, but the approval of two other medical or mental health providers, both having training specifically in this area of gender dysphoria. So that's why it's irrelevant. It's irrelevant because, as the gentleman from the 54th stated, there's a letter put on your desk earlier this week from about 400 medical providers from West Virginia who oppose this bill because this type of treatment is recommended by every major medical organization, and it's about protecting kids from suicide. The very narrow exemption that's being removed in this bill puts our kids at greater risk of suicide. Even though I spoke against and voted against the Parents' Bill of Rights, there are some things in there that I think are accurate and true, and values that I share. I do share values that parents are the ultimate decision makers for their children's healthcare decisions. I also highly value the opinions of doctors who are providing care to West Virginians who are dealing with such a difficult situation. Have you spoken to any of those doctors who are providing gender-affirming care to West Virginia kids? There's a list of 400 of them on your desk if you want to reach out to one of them, or if you'd like to talk to one, let me know and I'll hook you up. We'll get on a Zoom call with them. Because I think if you actually have a conversation with someone who's providing this type of care, it may change your mind. Because these healthcare providers are making valiant efforts to keep our children alive. They're on the front lines. They're dealing with real-world situations. This body does not include a lot of medical professionals. I'm certainly not one. Just like the Parents' Bill of Rights doesn't allow us to do that, we should not be doing that in this bill. We should not be substituting this body for medical professionals that are working on the ground in our communities to keep our kids safe. That's why I oppose this bill.
Gentleman of 55th, Doug Akers is recognized.
Thank you, Mr. Speaker. When I first heard about this bill, I looked at it very carefully because I did have some concerns. Gender dysphoria is not a new condition. It's been around for a long time, and I did have questions about whether it was going to prevent legitimate psychiatric care under limited circumstances, and I wanted to at least get those answers for myself. And I got a bunch of emails that were obviously generated by a call to action by people who I think simply attack this body for going after kids or going after doctors. And when I asked the questions from the chairwoman of health from the 73rd, I was pretty sure I knew what her answers were going to be, but I wanted to ask her anyway to get that affirmation on the record. I thought that was important. Because when I read this bill, I saw it the way she sees it, which is it's actually less restrictive than it was before. In this simple addition on lines 26 and 27 on page 2, make it clear that gender-altering medication cannot be prescribed only for the purpose of assisting an individual with gender transition, which is already the law in this state. Whether you like it or not, that's what the law is. So we have affirmation that this medication can still be provided for psychiatric treatment, which was my main concern, and that's not changing. And no one in this body is against the physicians or healthcare providers who provide this care. I've talked to some myself. I've done that. I know people who suffer from this condition. That's not what this bill is about. And it's the worst part of politics, I think, when we send out these calls to action. That can happen on both sides, not just one or the other, but send out a call to action and we genuinely alarm people and make them think, for example, that their child may be in danger of killing themselves because of a piece of legislation that's not actually going to do that. And I've gotten a bunch of emails about this from parents and physicians who I can tell are alarmed, but they don't actually, and this is no insult to them, they're too busy to read all of our bills. They don't know what the bill actually says. They were just told that it's going to cause harm, and they believed the people who emailed them and trusted them to tell the truth. But that's not what happened here. You know, earlier today, I never would have accused the gentleman from the 25th of saying or said that he wasn't for children being educated or parents having a right to choose education. I think he was genuinely interested in protecting public schools and the funding that go along with those. This bill is not about trying to take the option of genuine psychiatric care away from these families and their children, and to say that it's taking away the parents' rights somehow. I feel like my mind is somewhat in a pretzel because a child can't consent to this in the first place. A child can't go to the doctor by themselves and ask for these medications. The parent has to consent, or some other legal guardian. That has to happen. And the issue of child consent is the reason why this entire issue came up in the first place. Because can a child truly consent to the more severe or serious types of treatment that were previously banned in this bill? That was the issue that was, I think, at the heart of it was, is the child truly even consenting to what's being done to them? And here the parent still has to consent like they did before, actually in a less onerous manner. So I appreciate the affirmation from the chairwoman of health, the gentle lady from the 73rd. She will not stand up in this chamber and tell us something she does not believe to be true. She tells us that this bill will still allow children who are suffering from gender dysphoria and need this treatment for psychiatric conditions to continue to be treated. I want any parent or physician who's involved in this to listen to that again. We have affirmation from the committee chairwoman where this bill came from, who told us here today that any child or any physician involved in this process will still have the same ability to seek and receive medication for psychiatric treatment if this bill passes as they did yesterday or today. I think it's important for that true message to get out for people who are genuinely concerned about the care they provide to these children and for the families of these children who are concerned for the people who they love. I urge passage. Thank you, Mr. Speaker.
Lady from the 56th, Delegate Young's recognized.
Thank you, Mr. Speaker. Hi, colleagues. I appreciate my friend from the 55th talking to doctors about this. I appreciate anyone who talked to doctors about this. In the bill, I find it interesting that irreversible gender reassignment surgery says just that. And then gender-altering medication doesn't say irreversible. And that's because it is reversible. It's completely reversible. All that these medications do is stop puberty. And I'm sure, quite frankly, all of us probably wanted to stop puberty for some reason or another because, God, it's awful. And these kids just want a little bit more time. All these medications have been used on children longer than I've been alive for a variety of reasons. they are developmentally appropriate, they are age appropriate, and they are reversible. Every single medical association, every single national medical association supports gender-affirming care in every capacity. And what this bill does is restricts gender-affirming care. Last year's bill restricts it, this year's bill restricts it, just restricts it differently. That's all it is. This is just another color, but it still restricts gender-affirming care. This care can be life-saving for kids, life-saving for children. And I want to talk about that for a minute because a few weeks ago, we had a really, really heartfelt testimony where a lot of people on both sides of the aisle got up and they talked about suicide and how it affected their family and how it affected their lives. And I think we probably all shed a tear, and that was an interesting day, and it was really nice to see everyone show emotion, and I appreciated it a lot. Suicide is the second leading cause of death in kids aged 10 to 14. It is the third leading cause of death in kids aged 15 to 24. When we talk about LGBTQ kids, those rates are 4 times higher. In 2022, in West Virginia, 50% of trans kids thought about suicide. 20% of them actually attempted it. That is horrible, horrible. These are not statistics that we should be proud of at all. Gender-affirming care has been known to reduce suicide by 75%, and I don't think that we should be restricting it in any capacity. If we want to talk about consent and this bill not having consent last time, this time, if you want to write a bill about parental consent, we could do that, but that's not what this bill does. This bill restricts care for kids. It takes away parental rights. It restricts health care, and I think if it becomes law, more West Virginia kids will die. So for that reason, I'm a no.
Gentleman from the 54th, Doug Pushkin's recognized.
Thank you, Mr. Speaker. I just take a bit of umbrage with something I've heard, that the worst side of politics, emails, phone calls, other messages from advocates and people who care deeply about this bill, possibly because it affects their child, their loved one, or maybe their patient. I don't think that's the worst side of politics. I think the worst side of politics is what we're going to see after some of us vote no on this, and we're accused of mutilation or castration. And those are the words you'll see used, and that's the worst side of politics. And I don't really care what it does to those of us who vote. The problem is that this type of legislation that's simply meant to unite people against a common enemy, this type of legislation also has real victims, because it creates a chilling effect where the doctors aren't going to want to practice this sort of thing. And worse than that, it tells a very vulnerable segment of our society, these kids who've probably been picked on enough, tells them that their legislature, their elected officials don't even think they should exist. So, let's try not to take the high road and talk about the bad side of politics, because that's all this is about. When we get called back into a committee room at the last hour before we can get House bills out, just to put out this meaningless legislation that's only meant to help people get elected and meant to be the subject of postcards talking about mutilation and castration. So give me a break on that. That's what this is about. It's the worst kind of election year politics. And unfortunately, real people do get hurt. We should care about them.
Gentleman from the 20th, Douglas Foster is recognized.
Thank you, Mr. Speaker. I stand in support of this bill because it removes an exception that was inserted in the Senate side for this type of I don't really want to call it treatment, because it's not used as treatment. They're using the problem with these puberty blockers is that it's being prescribed as a treatment. The lady mentioned that, saying that it decreases suicide. There's no proven methodology that says that it actually does decrease suicidality. What does help these children, in many cases when they're suffering through gender dysphoria, they're also suffering from comorbid situations such as depression. And I think when we say, well, we're going to treat this by gender-affirming care and switching someone's gender, and that'll fix the problem. Well, the suicidality rate is the same before and after transition, or before and after these drugs are prescribed. And what we're doing by saying, well, let's go ahead and prescribe these drugs, such as Lupron or another, it's not fixing the problem. We're providing a solution that doesn't solve the problem. And by removing this exception, I think we're focusing more on getting these kids the help they need, which is many times these comorbid situations where they're dealing with depression, and situations where something that would not be a life-altering drug that could help them cope with something that is an issue they're dealing with. And I think it's pointing doctors in the direction of actually treating the issue of the suicidality problem and the depression, rather than moving to a solution that's not working. So I would urge adoption of the bill, or passage of the bill.
Lady from the 81st, Douglas Hamilton is recognized.
Thank you, Mr. Speaker. I just want to respond to some things that was just stated. We know that gender-affirming care is a touchy topic, but legislation that affects gender-affirming care removes an access to care that our children are crying out that they need. Data has shown that it is effective in bringing down anxiety, depression. and suicidal thoughts. But here's a caveat that we have not considered, and the reason why some think this data doesn't, the reason why this form of care doesn't work is because when we pass this type of legislation, it sends a message to our other youth, and they begin to increase in their violence in school and in their bullying. Just on Monday in Oklahoma, there was a non-binary kid that was beat up by 3 other students in his school. He had complained of bullying and it was not addressed, another problem that we have in our educational system. This young kid died. He's gone. So can we say that the medicine didn't work? Medicine could work. But what affected this child was not the gender-affirming care, but it was the bullying and the violence that he was subjected to because of his declaration and saying that my gender identity isn't what was assigned to me at birth. Sometimes we miss the humanity of what these bills do and how it affect and the messaging that comes across, especially to young minds, minds that can be, that can be easily influenced. So the gender-affirming care data shows it does help decrease anxiety, it does help decrease depression, and it does decrease suicidal ideations. But this type of legislation has shown to have a negative effect upon all youth because it does increase violence against our youth and violence through bullying and through physical altercations. So that's the caveat that we have to consider whenever we're dealing with this type of legislation. So I think it's important to lend our ear to what over close to 500 doctors have said in the state of West Virginia, that they stand by this care. It is an access to have a better outcome. Will it fix everything tomorrow? Absolutely not. And if you know anyone or if you ever suffered with depression or anxiety, you know it's a roller coaster in life. If you've ever dealt with people who have suicidal thoughts, they battle this all day. It's just not one time they have a thought. It's all day. And if something occurs to them, it's an internal struggle that they deal with, but then on top of that, they have to deal with the external struggle of how society treats them. They deal with this 24 hours a day, and for a young, fragile mind, they cannot handle it. So I feel like it should be our responsibility and duty to do whatever we can to save the lives of our youth. And if doctors say this care through data shows that it helps, then I'm going to stand with our doctors. Thank you, Mr. Chair.
Gentleman, the 38th, Ellington is recognized.
Thank you, Mr. Speaker. Would the distinguished chair lady of health from the 73rd respond to a few questions?
Distinguished, obviously.
I'm distinguishing you. Questions, clarification from me. As you know, my specialty as a GYN, I deal with prepubertal and adolescent females. So would this bill in any form affect my ability to do corrective surgery for anomalies or injuries?
Would not.
Okay, just as long as it's not something that would be gender transforming.
That's
Okay,
gender transitioning, unless in the exception, they had one of the sexual
anomalies that would be
disorders
corrected,
or developmental
okay,
issues.
that we currently can do. How about as far as hormonal treatments for various conditions in pre-adolescent females?
It would not be prohibited unless it was supraphysiological for the purpose of assisting in gender transition.
Right, and the supraphysiological puts them at more complications, so that's one thing. A question that came up that I looked at, in the course of my specialty, we have to take call at hospitals, which means these may be patients that I may not have in my practice, but I may have to encounter on call. So let's say you have an individual that is transitioning here, and they happen to be admitted to the hospital. I get consulted. Sometimes when we have people that are on certain medications, that we may not be, by DEA, able to prescribe. We're allowed to do so in the hospital setting. Just for that temporary time, we're not allowed to prescribe outside of the hospital setting. So if a person is on these high doses of hormones, would I experience any liability if I had to continue that for the safety of that patient while in the hospital?
I do think it's a little bit of a gray area if a patient, say, comes from Pennsylvania or Virginia where they allow this treatment and they end up in West Virginia hospitals if they are on the high doses. I do know that in our law here, we do not have criminal penalties or revoke licenses in any section for providers. I do know that patients could bring their own medicine and take their own medicine. As far as you prescribing a supraphysiological dose, I do think that's prohibited.
Thank you. That's all I need to know. Thank you. Thank you, Mr. Speaker.
Is there other debate on the bill? Gentleman from the 52nd Delegate row is recognized.
Thank you. If the kind lady would answer some questions.
Yeah.
There's been a lot of information, and I'm going back and forth, and it appears that the same information is being struck in two different sections.
Right, because we have an MD board and a DO board currently, so we do have to write those under each section.
Okay.
But it's the same language in both sections.
Right, and I was looking elsewhere, as I understood your answers to other questions, that all of that we're striking is already in there and it's no problem, but I can't find anything that deals with the psychiatric condition that would lead to suicide. I've looked in both sections and I don't find it. Let me read something here that troubles me.
You can't find it because it's not prohibited. This is about prohibitions of practice.
Yeah, but if you're a physician and you were to read this bill, you would feel very concerned about a psychiatric condition that might lead to suicide, because we have in the statute this language that is to be taken out. And it says that the minor and so on charged with medical decision-making from the, wait a minute, I'm in the wrong section. On page, let's see, page 5, there's one set of these, and it's on lines 48 to 50. And it says that that the diagnosing medical professionals express in a written opinion, I think there was some question about whether there was a written opinion required in the statute or not, but there is a written opinion required, that treatment and that we're talking about in the therapy is medically necessary to treat a minor's psychiatric symptoms and limit self-harm or the possibility of self-harm by the minor. Now, I don't see anything in either section that talks about psychiatric disorders leading to this kind of therapy. And what we're taking out of the law is the fact that, without question, it's a pretty limited procedure. You have to have two physicians sign a written opinion, has to be joined and agreed to by the parent, and it deals directly with psychiatric disorder. If we vote for this bill, that goes out of the law, right? And is there some place, because you said several times that there's some place in here that has all the provisions that we're taking out, and it's sort of a flip, as I understand your answer, that because this is a bill that prevents certain kinds of treatment, the fact that we're not preventing treatment of a psychiatric disorder that might lead to suicide, that's not prohibited. But if I were a physician, I would read this to say that it is. I'd be thinking, if I'm going to use this therapy, how is it that I can use it for a psychiatric disorder rather than the very physical kinds of disorders that are discussed in the bill that we're not altering? And I just wanted to know what your take on that is.
I think your questions prove exactly why the language needs to come out of the bill. It has created confusion amongst all the legislators and probably providers. And so now they're concerned about taking it out, that they can't take care of kids that might have suicidal ideations. The original intention of the bill is only to prohibit 2 practices in the state of West Virginia for minors. 1, irreversible gender reassignment surgery, or gender-altering medication for the purpose of assisting an individual with a gender transition. I think the additional language that was added last year has caused some confusion.
Yeah, but it addresses the issue pretty clearly, I think, by talking about physical conditions. I mean, it's very careful about that they're allowed to treat physical conditions.
Well, because we're talking about irreversible surgery, we need to list what those exceptions might be. If you have had a serious injury where you might have to have a irreversible surgery that might change, right?
Sure.
Then that's why that's specified.
Yeah, I mean, there's no question that they need to have some clear direction about what is allowed and what is not allowed, because the general provision is, I think, at the top, says that physicians cannot do anything that would transition a minor or would provide them with gender-affirming therapy.
It doesn't prevent gender-affirming therapy. Gender-affirming therapy is much more than a hormone. I mean, we allow individualized behavioral therapy. We allow peer group support. We allow medication as long as it is not in doses that are gender-altering for the purpose of assisting in a gender transition.
So we don't need to address psychiatric disorder therapy.
I think it's not that we don't need to address it. I think that the bill clearly does not prohibit it. And we're talking about prohibited practices. That's why that language made it a little bit confusing about an exception, because it's allowed. Well,
I don't read it that way. I think that the provisions are really, almost threaten providers. If they were to provide this kind of therapy, they would be in jeopardy of losing their licenses, because there's nothing in the statute that allows them to use these therapies for a psychiatric disorder, particularly leading to, how do they put it here, self-harm, which is suicide. There's a silence about that, and if we're trying to prescribe certain therapy, the use of certain therapy, shouldn't we have a provision for psychiatric?
I'm just going to have to disagree. Now, I may agree with you that the construction of the bill could be better, but this bill, when it was originally introduced last year, only dealt with surgeries. So then when hormones and some of these other things were added in, I don't know if it was constructed the best. However, I do know what it says, and I do know what it says is prohibited, and it is the 2 things that I've repeated endlessly.
Well, my memory is, in fact, that surgery was added, and then there was an amendment to add in the hormonal therapy. So both were barred, and that was the reason that psychiatric was put into it, because there's no allowance to use those therapies for anything that other than certain physical activities that are listed.
Where does it say that it's not allowed?
Well, it says it by what they're allowed to do. I mean, in the way
those are only the exceptions to the prohibited practices.
Right. Right.
So if you're born male and you need to be made a female because the anatomy is not there to support that, that is an exception. You are going to need to do something that is prohibited. You're going to have to do that. That's why it's accepted there.
Well, it's clearly a statute that forbids medical practice in regard to surgery that would be transitioning surgery or transitioning medications.
That is correct.
Okay. and then there are exceptions listed. And what we're taking out, if we vote for this bill, is we're taking out the exception that they get to treat with these therapies, just like for a physical disorder, they get to treat a psychiatric disorder when it is to prevent self-harm, i.e. suicide. But if we vote for the bill, we're taking out the psychiatric permission, the permission for a psychiatric disorder. No?
I'm just going to have to disagree.
Okay. All right. Thank you very much.
You're welcome.
I appreciate it. Mr. Speaker, I would like to speak to the bill.
Gentleman is recognized for that purpose.
You know, this is really frustrating, you know, and you really think that when we go into something as tender and difficult as transitions of people on their gender, it's hard to understand it, and the best way to understand it, I think, is to know folks who have done that and who have needed to do that. For their own sanity and to prevent their own suicide. I think we need to, I respect the lady's opinion, but as I read this, there's no doubt in my mind that we are taking out the legitimate exception that was in the bill last year for psychiatric disorders leading to self-harm of the patient. And what we're doing by deleting that and saying, well, we don't have it, it's not prohibited. Whoa, 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 whoa. It's the use of the medications. And if with these kinds of hormonal medications, a physician is going to be very careful about prescribing them, because even with a psychiatric disorder, even if needed to prevent a suicide, particularly when reported by parents, a physician's going to have difficulty reading this statute to say that, oh yeah, whenever the legislature returned to this very statute that outlawed any transition therapy either by surgery or by medications, hormonal medications, they really, in taking out the exception for psychiatric conditions leading to suicide, when they took that out, they meant to, they didn't mean to make it illegal, they meant to just let it kind of hang and just sort of be something that you could treat or not treat. I think it's very clear that voting for this bill means that we are voting to take out the words that you see on your screen right there, and it says medically necessary to treat the minor's psychiatric symptoms and limit self-harm or the possibility of self-harm by the minor. We're taking that language out of the law. Thank you, Mr. Speaker.
Gentleman from the 53rd, Delegate Pritz, recognized.
Thank you, Mr. Speaker. Would the Chair of Health yield, please?
Yes.
So I'm taking a look at pages 2 and pages 3 here of the committee substitute. So certainly I think based on this, where the exception that was added in there, and it's this long litany of things that's like a test, talking about, well, you know what I'm talking about there, that we're taking.
Oh, yes, I've read this many times.
Okay. So I was taking a look at that part there, but then I was also taking and that's the exception that we're taking out, which I think is a good thing. But I was looking at the language on page 2, lines 25 through 27. And there's this phrase that was added in there. And it says, except as otherwise provided in 30-3-20, a physician may not provide irreversible gender reassignment surgery or gender-altering medication, and this is the part that's added in here, for the purpose of assisting an individual with a gender transition to a person who is under the age of 18. Okay, just so it's clear what we're talking about here.
And I'd like to say, I only added that for clarification because that is what the definition on the first page says. Gender-altering medication means the prescribing or administering of the following for the purpose of assisting an individual with gender transition. So I only carried the definition over to that statement to make it clear, more clear.
What page, I'm sorry, what page
So
is that
the
definition?
definition for gender-altering medication is in the first page on line 8 under prohibited practice where we're talking about definitions. Very first page.
The very first page, okay, just briefly.
Under definitions, gendering-altering medication, I carried the definition over to line 25B, where we talk about the exceptions, just to make it clear what gendering-altering medication is.
Okay.
See where I copied the definition?
Well, just where it says gender-altering medication means the prescribing or administering of the following for the purpose of assisting an individual with a gender transition. I see. Okay, so by adding that phrase in there, for the purpose of assisting an individual with a gender transition, I'm just taking a look at that then. Is there, under the bill as it's constructed right now, let's say a doctor states and claims that it's for some other purpose, let's say for mental health treatment, then are there any limitations on what gender-altering medication can be prescribed?
No.
Okay. All right, thank you.
Debate on the bill. Gentleman on the 25th, Delegate Hornbuckle.
Thank you, Mr. Speaker. Friends, I will not be accusatory. I will not be accusatory because I know that there is confusion on this bill. I know that some of you in this body today are struggling deep down. I know that for sure. I always aim to be the voice of reason. And with that, I will tell you that you do not have to agree with this potential medication, procedure. You do not even have to agree with what some might think is a lifestyle. You do not have to do that to be able to protect children. Is what that boils down to protect children. You know, quite simply, this bill, in short, is about protecting vulnerable kids from suicide. That's what this measure is about. Earlier this session, we passed a measure on being against euthanasia, medically assisted suicide. One could argue that this measure could be legislative assisted suicide. This is a very important topic that we're dealing with here today, and it boils back to protecting children from potential suicide. I just briefly want to share some words from a West Virginian from a small coal town. Sometimes in our lives, we all have pain. We all have sorrow. But if we are wise, we know that there's always tomorrow. Lean on me. When you are not strong, I'll be your friend. I'll help you carry on. For it won't be long till I'm going to need somebody to lean on. Please swallow your pride. If I have things you need to borrow, for no one can fill those of your needs that you won't let show. You just call on me, brother, when you need a hand. We all need somebody to lean on. I just might have a problem that you'll understand. We all need somebody to lean on. Lean on me when you're not strong. I'll be your friend. I'll help you carry on, for it won't be long till I'm going to need somebody to lean on. Just call on me, brother, when you need a hand. We all need somebody to lean on. If there is a load you have to bear that you can't carry, I'm right up the road. I'll share your load if you just call me. That's by Bill Withers, but more importantly, that was by a group of kids sung out here not too long ago that all of us nodded and smiled and clapped. They know the way. This is not about a lifestyle. This is about protecting potentially suicidal kids. And I would urge the body to not vote for this measure, because if we could protect just one, it would be worth it. Thank you.
Lady from the 73rd to close debate on the bill. Debate on the bill has been closed. Question now, shall the bill pass? Those in favor of passage of the bill will vote aye. Those opposed will vote no. The clerk will prepare the machine. Has every member voted? If so, the clerk will close the machine and ascertain the result on that question. There are 88 ayes, 11 nays, 1 member absent. Majority of members having voted in the affirmative, the chair declares the bill passed. Clerk will please report the title.
Committee substitute for House Bill 5297 relating to prohibiting pubertal modulation and hormonal therapy when provided to assist in a gender transition.
Are there title amendments? If not, the title as read by the clerk will be and remain the title of the bill. The clerk will please communicate the action of the House and the Senate. Next bill on third reading.
House Bill 5305 relating